Non-communicable diseases, NCDs, are a group of conditions that are not infectious and cannot be transferred from one person to another. These diseases are a consequence of behavioral, hereditary or standard of life factors such as smoking and improper diet. These include cardiovascular diseases, cancer, mental health problems, diabetes, chronic respiratory diseases and musculoskeletal conditions. Chronic care of NCDs has been noted to strain household incomes as families in Kenya bear the burden of caring for loved ones ailing from NCDs. NCDs further contribute to household poverty as less income is channeled to investment, thereby stifling economic growth. This is compounded by lack of access to adequate health infrastructure to care for those affected by NCDs. For almost a decade now, the African Institute for Health and Development, AIHD, has been conducting research, training and advocacy in health and development that is contextually relevant to Kenya and the African continent to deal with the NCD's menace. The African Institute for Health and Development is a non-governmental organization established in June 2004 in Nairobi, Kenya. Its mandate is based on 4 key development issues, which are health, poverty alleviation, child health, gender and youth.
AIHD was formed by a group of researchers to create a link between research and community action projects. A lot of research is being done, but there is no clear linkage between the results and programs that can impact on people, on families, and on communities. Other program is health promotion and non-communicable diseases. Now, this program deals with the ways of promoting health in Africa and in Kenya in particular, and it is this program that is also closely linked to non-communicable diseases. Non-communicable diseases or conditions are conditions that are not transferable. Like if you have cancer, for example, you cannot transfer it to the other person. If you have diabetes, it's very difficult to transfer it to the other person, unlike infectious conditions.
NCDs are the single biggest cause of death in the world today. 9 out of 10 deaths from NCDs before the age of 60 globally occur in developing countries, especially in sub-Saharan Africa.
The major non-communicable conditions globally are diabetes, cancers, and chronic respiratory diseases. These 4 conditions causes over 2/3 of deaths globally every year. That is about 63% of the global deaths every year are due to these 4 conditions. And these 4 conditions have got common risk factors, which are tobacco use, alcohol use, unhealthy diet, and physical inactivity.
Contrary to common perceptions of NCDs, these are not just diseases of the elderly and the wealthy in developed countries. They mostly affect poor people.
2 decades ago, we could not talk of these conditions in Africa because they were known as conditions of the affluent. But I'm telling you today, they are no longer conditions of the affluent, because you go to our slums today, you'll find people that are having non-communicable conditions. You go to the slums, you find most of our youths, most of the people there are smoking. And they are smoking in the open. The people sitting nearby are also being affected. So you find that these chronic conditions are very prevalent now in the developing countries, where Kenya is one of them.
The main factors aggravating to NCD's burden in developing countries are increased level of exposure to tobacco use, physical inactivity, unhealthy diets, harmful use of alcohol, ineffective and inequitable health facilities. NCDs are linked by common risk factors and are largely preventable through changes in lifestyle. Low-cost measures can prevent millions of premature deaths every year through action against NCD risk factors. Diabetes. Diabetes is a group of metabolic diseases in which a person has high blood sugar either because the body does not produce enough insulin or because cells do not respond to the insulin that is produced.
If you look at the common risk factors, smoking, poor eating habits, lack of exercise, alcohol, overweight, they go across the board of almost all NCDs. You take mental health, most of the issues that come with mental health have addiction, drugs, smoking, alcohol. You look at cancer, stress, all these issues, they can go across. So if we all joined hands and tackled these common factors and went out to the community and preached about prevention, change our lifestyles, live healthy, eat healthy, exercise, stop smoking, stop this alcoholism, believe you me, the NCD will be captured and put under the lid very fast.
This high blood sugar produces the classical symptoms of frequent urination, increased thirst and hunger.
My name is Joseph Mboro, and I come from Thika, a place called Katora. It's in Gatanga constituency. The first time I learned I had diabetes, I remember I was actually in Form 1. I had all these symptoms. First of all, I lost a lot of weight. I was taking a lot of water, urinating every now and then. My skin had dried up and all those signs.
Diabetes affects the way the body uses blood glucose. There are two types of diabetes. Type 1 diabetes develops when the immune system destroys the insulin-producing cells in the pancreas, allowing a buildup of glucose in the blood. In type 2 diabetes, the cells resist the insulin and cause an increase of glucose in the blood.
There are two types of diabetes. There is type 1 diabetes that normally tends to affect children, but can also affect people of any age. Then we also have type 2 diabetes that is seen more commonly in adults, but we are seeing younger people, even people in their 20s, teenagers, and even a few children below 10 years now being affected with type 2 diabetes. We are particularly concerned about the threat of type 2 diabetes because type 2 diabetes is associated with lifestyle. And it is provoked by the way people handle their lives, the things they eat, as well as issues such as obesity, alcohol intake, as well as smoking and the lack of exercise.
Diabetes has various complications.
The major complications that we are concerned about are things such as the effects that diabetes has on the eye. Diabetes is a cause of blindness. It can be either temporary or permanent. When you get a cataract in the lens of the eyes, that causes temporary blindness, which once you remove the cataract, then the blindness goes away. But when it affects the back of the eye, the part called the retina, or the center where the vision is focused, then you get permanent blindness. Then diabetes also can affect the teeth. Somebody can lose all their teeth as a result of gum disease, as well as the heart. Diabetes can affect the muscles of the heart and the conduction system, resulting in problems with heart rhythm and even heart failure. Because of diabetes, you tend to have a problem with the blood vessels, clogging in the blood vessels, that can result in heart attack as well as stroke. Diabetes causes renal failure, and then also foot problems that can result in amputation, as well as sexual dysfunction in both men and women.
Diabetes management should concentrate on keeping blood sugar levels as normal as possible. This can be accomplished with healthy diets, exercise and use of appropriate medication like insulin. Patients' education, understanding and participation is vital, since the communications of diabetes are far less common and less severe in people who have well-managed blood sugar levels.
Mimi mwenyewe nilikuwa na matatizo ya kiafya. Matatizo kiafya yametokana na lifestyle ile ambayo nilikuwa naishi. Nilipobadilisha lifestyle, nimeona matatizo mengi yameenda. Mimi kwa muda wa miaka 12 nilikuwa nina ugonjwa wa sukari. Nikitumia tembe 2 asubuhi, tembe mbili jioni. Kwa hivyo 120 tablets a month times miaka 12. Lakini nilipoamua kubadilisha lifestyle, leo sukari imeenda zake.
Cancer, medically known as malignant neoplasm, is a broad group of various diseases, all involving unregulated cell growth. In cancer, cells divide and grow uncontrollably, forming malignant tumors and invade nearby body parts. The cancer may also spread to more distant parts of the body through bloodstream. Many things are known to increase the risk of cancer, including tobacco use, certain infections, radiation, lack of physical activity, poor diet, and obesity and environmental pollutants. The three most common cancers in women are breast, lung, and colorectal. Rectal cancer comes from uncontrolled cell growth in the colon or large intestines, rectum, or appendix. Its symptoms include rectal bleeding and anemia, which are sometimes associated with weight loss and changes in bowel habits.
I was diagnosed with cancer for the rectum in the year 2008, June. When my doctor came, he told me that I'm going to start the chemotherapy treatment. He told me one of the side effects is my hair will drop in maybe a week's time because it is like 99% side effect. And when I started chemo, it was really very challenging. The drugs were very expensive. I remember I used to spend like 100,000 per session, that is per month.
Cancer not only affects the patients but also strains household income, family resources and the family members.
When I saw my mom, I saw her hair had dropped and she was looking pale, she was looking, she had those symptoms for cancer. And me, I didn't know those symptoms.
Breast cancer is a type of cancer originating from breast tissues, most commonly from the inner lining of the milk duct that supplies milk and mostly affects women.
Hii ugonjwa wa cancer nili 1999 ndio nilianza kusikia iko na kitu kwa matiti yangu, lakini kwa maana haikuwa haina usugu, nilikaa tu bila kuenda kwa daktari. Lakini siku moja nikasikia hiyo kitu inaendelea tu, nikaanza kusikia sasa kama ni kitu inakuwa.
Lung cancer is at the top of the list for cancer deaths in men and women. Tobacco use is the leading cause of preventable deaths globally. Approximately 5.4 million people die each year from tobacco use. This figure is likely to rise to more than 8 million deaths a year by 2030, and the vast majority deaths will occur in low to middle income countries. In Kenya, palliative care centers improve the quality of life of patients and their families facing the problem associated with life-threatening illnesses through the prevention and relief of suffering.
Palliative care is actually defined by WHO, World Health Organization, is care that's given to people with life-threatening illnesses. And by life-threatening illness, I mean diseases that are not curable, that cure is not possible. And so these patients can receive palliative care, which focuses on improving their quality of life by addressing their physical symptoms, especially pain, which is most times neglected, and also psychosocial problems, emotional, spiritual issues are addressed in palliative care. The other thing about palliative care is it actually extends beyond the patient. It also focuses on the family of the patient because family members also get affected. So it also gives support to the family members during the patient's illness, and when the patient dies also focuses on supporting patients, family members through bereavement. So it really, the goal of palliative care is the best quality of life for the patients and the families.
Cardiovascular diseases. Cardiovascular diseases are conditions that affect the heart and blood vessels. These include atherosclerosis, coronary artery disease, hypertension, diseases of the aorta and its branches, disorders of the peripheral vascular system, and congenital or heart disease. Regular cardiovascular exercise, also known as aerobic exercise, is one of the best things you can do to improve your overall health. Popular aerobic exercises including brisk walking, running, swimming, cycling, and other activities that increase your heart rate for a period of time can also count. Overweight and obesity are major risk factors for cardiovascular diseases.
I've been living with hypertension for almost 30 years now. I found out when I had my first pregnancy. That is when the doctor told me that I have hypertension. And from that time, I've been living with it up to date. The doctor said that is something that I can control it, and he should avoid to make me annoyed, or not. You should not be annoyed, or you should not be very excited, because that is the time when you become annoyed or you become excited, then the pressure goes up. When I noticed, the legs were not swelling so much, but now the legs are, you can see when the legs are swollen.
Chronic respiratory diseases. The true cause of chronic diseases is personal behavior and use of tobacco, particularly smoking, which is the #1 cause of death and disability. Musculoskeletal disease. Musculoskeletal disease affects the body's muscles, joints, tendons, ligaments and nerves. The disease affects the body's musculoskeletal system that provides form, support, stability and movement of the body. The disease affects the function and overall effectiveness of the system. It is difficult to diagnose the disease due to the close relation of the musculoskeletal system to other internal systems.
Musculoskeletal diseases are the leading causes of early retirement. Those who retire before their age has reached, the majority retire because of musculoskeletal diseases. And they are the leading causes of disability. Those who are unable to perform their usual functions, most of them have got musculoskeletal diseases. The complications and risk factors really depends on each type of musculoskeletal conditions. The more commonest one of them is called osteoarthritis. And osteoarthritis occurs when the damage occurs to the joints and the cartilages of the joints. It's like the joint has failed. So the disability that occurs is because of pain. The patient experiences a lot of pain all the time. Then we have osteoporosis, which the bone becomes thin and causes multiple fracture, vertebral fracture on the spine. The person walks stooped, the respiratory function is compromised, and the person can easily get a fracture. And once they get a fracture and are admitted to hospital, the risk of dying are pretty high. In fact, the risk of dying from hip fracture following osteoporosis is just as high as the risk of dying from breast cancer. All of us are going to experience some musculoskeletal problems. There's nobody in this world who has not had a back